I'm humbled, honored, and excited to share this special moment with very dear friends and colleagues in this room. It's a landmark moment in the storied history of UT Health. It's the sixth school of UT Health, but the first one in more than 50 years. It's also the first one where brave leadership from UTSA and UT Health dared to dream a bold dream of partnering with each other and also with the city of San Antonio, with Metro Health, and with Bexar County. This School of Public Health is born into a great city, a city where people have always come first, where communities for centuries were nurtured by 5 creeks and a grand river, and subsequently their faith supported by 5 missions. It's a land where everybody is welcomed, a model of cultural plurality. Think hemisphere. It's a city where fair representation of workers was fundamental. Think Emergent. It's a city where the dream of an architect turned into the reality of a beautiful river walk. It's a city where women have equality and the leadership is respected. Think Mayor Cockrell. It's a city where social justice matters. Think Cops Metro. And it's a city where public leaders guided the public through the ravages of a pandemic. This School of Public Health is born at a very important moment in the nation's history. Never before in our history has public health been right front and center as we deal and recover from the ravages of a pandemic due to a virus which is mitigated but not yet gone. Even before the pandemic, we had our challenges. Our country spends a ton of money on healthcare, yet our people don't live as long as they could or as well as they should. Why might that be the case? In fact, we have a higher rate of preventable deaths, premature deaths, than our developed country peers. That's the gap you see on this slide, which Surgeon General Jerome Adams referred to as the US health disadvantage. Preventable because they can be avoided through effective public health and primary prevention. And why might this be the case? A postulated reason is that perhaps we underinvest in public health and social service. And to give you a flavor of what that means, for every healthcare dollar spent, most developed countries spend $2 on public health and social services. We spend 55 cents. And of that, only 2.5 cents is spent on public health. And why might that be important? Perhaps because most of the determinants of health lie outside the doctor's office. It lies in the families we are born into, in the neighborhoods where we grow up, in the communities where we go to college, work, live, and age. So-called social determinants of health. So what about the neighborhoods of San Antonio? And here is a sobering and disturbing fact. Among the 25 most populous metros in our country, San Antonio has the highest poverty rate, 16%. What is heart-wrenching is the fact that 1 in 4 children is born into that lifetime cycle of poverty, of opportunities that are not equal, of educational attainment that is limited, of health that tends to be poor. This cycle of disparities that begins in early life is not equally distributed or dispersed through the city. In fact, poverty is segregated in San Antonio. And death follows poverty like a shadow. So if poverty is segregated, it's little surprise that life expectancy is segregated. And the magnitude of the difference in life expectancy between the high hardship zip codes and the well-to-do zip codes is a staggering 20-year difference. Think about it. 20 years, that makes the difference between parents seeing their children graduate, parents seeing their children marry and have kids and hold their grandkids, things we take for granted. And it turns out that not only is life expectancy segregated, but poverty is the emperor of maladies. Along with it is segregation of a lot of maladies. All you have to see is that these zones in red mirror the poverty zones. So that diabetes, high cholesterol, heart disease, obesity, they all cluster in these regions. And whenever we see this, scientists think of common drivers, of root causes, or the causes of causes, if you will. And it is seldom the people. It is often circumstance or context. Health inequalities contravene the principles of social justice because they are avoidable, because they do not happen by chance or randomly, because there are social factors that determine this, which are beyond the control of the individual or his or her agency. And then came COVID. It ripped the band-aid of an ailing public health infrastructure that had been chronically underfunded and understaffed. Our national response was slow out of the gates, and public trust in federal agencies like the Center for Disease Control and the FDA was an all-time low. And there was an atmosphere of varying degrees of information, misinformation, disinformation. The WHO refers to this as the infodemic. As a consequence, it's sad that while the US has 4% of the world population, it has 16% of the COVID-related deaths. One of the other sad facts, the recent study from Brown University suggested that 40% of deaths due to COVID after the availability of the vaccine were preventable, and an estimated 29,000 deaths in our own state may have been preventable. And Texas leads the highest number of preventable COVID deaths in the country, in part because of a large population, notwithstanding the valiant efforts of our healthcare providers and our public health leaders. Into this moment, the School of Public Health is born. And it gives us a crystal ball into what's going to happen into the future. And what you see on this slide is the proportion of the Hispanic population in our country. In the latest census, it was 1 in 6. By 2035, it will be 1 in 4. By 2060, it will be 1 in 3. In other words, Hispanic health is critical for our national health. Other problems that are lurking in the shadows and emerging, the city and the region is an epicenter for diabetes. And underlying that is the epidemic of excess weight. And that is going to worsen on our watch till by 2030, over 50% of the people are likely to have excess weight. Furthermore, the growth in girth is not just of the state and the region, it's also the growth in traffic with development. And what you see here in red are the high congestion zones 10 years ago. And what you see here is what's going to happen after another 20 years. This traffic congestion, think of air pollution, think of noise pollution, think of respiratory diseases, think of environmental degradation, think of road traffic accidents. This is public health. And this is something that we can do as a School of Public Health in partnership with valuable partners in the city and in the county. It's not how big you grow, it's how you grow big that matters. And then There is this 100th parallel that divides our state. East of it, you get an annual rainfall of about 40 inches, and west of it, you get less than 20 inches. By 2016, from the 100th parallel, it had started moving eastward down to the 98th parallel. Our heartland is getting hotter. And if the climate change problems, as predicted, lead to a 1 meter or 2 meter rise in sea level, there will be coastal flooding. And the predictions are, within Texas, there will be a displacement of nearly 500,000 people. And there will be an external influx of people. Close to 1.5 million people from Louisiana and Florida will enter Texas. These are emergent public health problems that lie directly in the purview of everybody in this room, the School of Public Health, the entire city, and the entire region. And this climate change, sadly, will affect excessively the people of color. It will affect the low-income groups. It will affect the older people. It will affect the kids disproportionately. Vector-borne diseases, diarrheal disorders, lung disorders. This is what we are looking at unless we do something about it. And that is the vision of the School of Public Health. We are born at a time we have to address the current problems, but also predict, anticipate, and prevent the future problems in South Texas, maintaining a state of health and well-being. So, what do we mean by public health? And one of the best definitions I've seen is from the Institute of Medicine. And look at the emphasis on words as I read it out to you. Public health is what we, as a society, do collectively to assure the conditions in which all people can be healthy. Because if we are not all healthy together, none of us is as healthy as we could be. That is the premise of the School of Public Health. And when we say we, I don't just mean humans. We mean our flora, our fauna. Because we know from the COVID pandemic, we need our livestock to be healthy. We need our pets to be healthy. We need our wild animals to be healthy. We need to replace our industrial mindset with an ecological mindset that's more conducive to keeping the public healthy. That's referred by WHO as One Health. And we need to shift the conversation from talking about preventing illness, maintaining health and vulnerability, thrivability, wellness, mental health and well-being, emotional health and well-being, social health and well-being, spiritual health and well-being. And that represents the self-actualization of human potential of every person in the city, in the region, in the county, in the state. And that is the tripartite mission of our School of Public Health. We want to educate the workforce of the future, to fill the jobs of the future, to do research that directly targets the current problems and the future public health problems that we face, and to do service that actually matters to the communities, that actually matters and makes a difference in their daily lives. And our education is learner-focused. It's more learning environment-focused. It's more practice-based. It's more consistent with the notion that learning is polyvocal. We have to listen to many voices, understand many perspectives. That intelligence is non-unitary. Different people learn in different ways. And public health is transdisciplinary. It has to be viewed through multiple lenses. And that is our mission. So how will we do all this, which seems like a grand vision? There's an African proverb that goes, if you want to go fast, go alone. But if you want to go farther, go together. So we're going to harness the partnerships between UT Health, UTSA, the city, Metro Health, the Bexar County, to harness the brain trust, the human power of these to address the public health problems. And everything that we do has to have the focus, the community at the center, where the community is empowered with solutions the community wants, And these are called community-driven solutions, so that the divide between the town and the gowns gets bridged in a way that has meaning to the town. It means our partnerships have to go beyond metro health. They have to go with the city, with the transportation department, with the housing department, with the food department, with the legal department, so that we can have people walk on safe streets, live in affordable, safe housing, so that they can have transportation that is safe, so they can eat healthy food. This is a multilateral collaboration that the School of Public Health and the constellation of partners hopes to do together. Diversity, equity, inclusion, and belonging are right front and center, a core feature of a School of Public Health. Cultural knowledge, awareness, sensitivity, fluency, humility is right there as a core value. The School of Public Health timeline, just to give you a window, by late spring we hope to have the accreditation of some of the bodies which are prospective accreditors. And in 2024 we hope to admit our first batch of graduate students. Thank you, Dr. Potter. And in 2025, we launch our ambitious doctoral program across UT Health and UTSA. And together, the Collaborative School of Public Health hopes to achieve accreditation in 2027. I want to end by telling you the story of 3 French nuns who came to this city in 1869. They had very little money. They spoke little English. And they traveled 3 weeks from Galveston. And their aim was to set up the first civilian hospital in the city. They arrived to find that the building they hoped to convert into the hospital had just burned down the previous day. And in December of 1869, they commissioned the Santa Rosa Infirmary, the charity hospital, the nuns, the sisters of the incarnate word. And the reason I tell you this story is because if our minds can conceive it, if our hearts can believe it, I believe, I know we can achieve it. And we'll do all this together, my friends and colleagues. And thank you for being here, and I look forward to our partnership into the future. Thank you.